Let's discuss the adult tachycardia algorithm by ResusUK 2021. For any unwell patient, you will assess the patient by using an A to E approach, and then you would look out for any adverse signs. Adverse signs represent that the heart is not able to generate enough cardiac output. For example, systolic blood pressure of less than 90, syncope or myocardial ischemia if the coronaries are not being perfused, or signs of severe heart failure if the heart is not able to pump very well. If any of these adverse signs are present, then you can give up to 3 synchronized DC shocks. And if that's unsuccessful, you can also give amiodarone 300 milligrams as a bolus over 10 to 30 minutes and seek a specialist advice for further DC shocks. If no adverse signs are present, then your management would depend on whether the QRS is broad or the QRS is narrow. If the QRS is broad, for example, if it's more than 120 milliseconds or more than 3 small squares, then you need to see whether it's regular or irregular. If it's regular, then it most likely represents a ventricular tachycardia, a stable ventricular tachycardia, where you will give IV amiodarone 300 milligrams over 10 to 60 minutes, usually over 60 minutes. If the QRS is broad and irregular, that can represent polymorphic VT, and for that you will give 2 grams of IV magnesium sulfate over 10 minutes. Or if the QRS is narrow, for example, if it's less than 120 milliseconds or less than 3 small squares, then it could represent a supraventricular tachycardia, for which the management is starting with a vagal maneuver only on one side or Valsalva maneuver, and after that followed by 6 milligrams, 12 milligrams and 18 milligrams of IV adenosine, unless the patient is asthmatic, in which case you will use verapamil. If the QRS is narrow and irregular, that can represent atrial fibrillation, and the management of atrial fibrillation would be rate control, rhythm control, and anticoagulation if appropriate.